You had your cesarean section. Now, the wound has refused to heal. What exactly may be going on? Why is this wound not healing? 3 weeks, 1 month, 6 weeks, your wound is still the same. Here are 7 things that can delay your wound from healing, that can cause your wound not to heal, that can make your C-section wound to open up. Number 1 is if your blood level is low. Okay, PCV is low. Maybe you had massive blood loss, you lost blood during your C-section. It can make your PCV to go low. And for wound to heal, there must be adequate blood in the body, because the wound needs the nutrients from the blood, the oxygen, and everything that the blood carries. It needs it to heal. So if your PCV is low, your blood level is low, it's going to delay your wound healing. Number 2, if you are not eating well, if you are malnourished. Now, this is not about the quantity of food you eat. It's about the quality of the food you eat. The food you are eating after your C-section. Is it a food that will help you to heal, or you are just eating for eating's sake? My dear, the kind of food you should be eating after cesarean section should be the food that will help you to heal, will help the cells to rebuild, help the tissues to repair. That is why I keep telling you, you must not neglect your proteins. Your proteins. This is the powerhouse that your body needs to heal. So your eggs, you must eat eggs. Try to eat. Eat fish, meat. Take yogurt. Okay? Eat lentils, legumes, maybe beans. Eat food to help you to heal very well. Because if you don't have enough protein in your body, it's going to affect your wound healing. It's going to delay your wound healing. So please, eat well. Take enough vegetables, your greens, green vegetables. Add your fruits. The body needs vitamins to heal well. Okay? Then number 3, if you are not compliant with your medication, you've had your cesarean section, 3, 4, 5 days afterwards, you are discharged. Some persons may be discharged with antibiotics, depending on your case. Some may not need it. Then others, you may still have things like vitamin C, fesolate, your folic acid. All these drugs that you are given to take at home, please take them as they have been prescribed. Why they were given to you is to help you. They all have function to help you recover, including helping you to heal, including helping the wound to heal very well. Now listen very carefully. This thing I want to say is very important. If you were given a prescription, you are given a prescription to take for 7 days. For instance, you were asked to take a particular antibiotics for the next 5 days, 3 times in a day for next 5 days. Maybe each time of the day, you are taking 1 tablet, 1 capsule, depending on the drug. That means every day you are taking 3 tablets, right? For the next 5 days, you will need that drug. You are taking 15 drugs. Are you with me? Now, on your way back from the hospital, probably the hospital gave you drugs, or they asked you to go and buy from the pharmacy, and you were given maybe 1 sachet. You know that 1 sachet is not even up to 15 tablets, my dear. Once that sachet finishes, make sure you complete the remaining part of the drugs. Don't say, I finished 1 card. Because some mothers are fond of this. Once the drug they gave you from the hospital finishes, you don't care to know whether that is the right time or that is the right number of medication to take. Don't say, my doctor, the drug they gave me home is finished. Find out. Ask questions. How many days am I supposed to take these drugs? You wrote I should take vitamin C 3 times a day, 2 tablets. How many times am I supposed to take it? How long? How many weeks? How many days? This will make you to know how many tablets So that once it finishes, you know that, oh, I have not yet finished taking this drug. I have not yet completed it. Doctor said I should take it for 2 weeks. Doctor said I should take it for 5 days. Now the drug has finished. I need to replace. Because if you don't take the drugs prescribed for you, it's going to affect your healing. It's going to affect your wound healing. I hope this is clear. Then number 4, your wound care. You have been discharged. Maybe your plaster has been removed or yet to be removed. Or it's okay, go and be dressing your wound, okay? Go and dress it. I will see you in 6 weeks' time. We'll see you in 4 weeks' time. My dear, be careful where you dress that wound. Be careful what you use to touch that wound. Don't get it soaked. Don't go and be applying anything that was not prescribed for you from the hospital. You may say, somebody used it and it worked. You are not somebody. And somebody cannot be prescribing for you when you have a doctor, when you have a caregiver, when you have a nurse that is caring for you. If you have any issue, you go back to the hospital and clarify. So please, make sure the wound is dressed in a place that is safe. If it is in the medical term, they say it is sterile. It is void of bacteria. If you use what is contaminated with bacteria, what is no good, it's going to affect the wound healing and may lead to wound breakdown. So make sure that your wound is not wet, it's not soaked, it's always clean with the right materials recommended for you. I hope it's making sense. Number 5, if you put too much pressure on yourself, you are straining yourself. Before 2 weeks, 6 weeks, you are already everywhere. You are putting so much pressure on your wound. That wound can open. The stitch can lose. Or you don't know that it was stitched. So you need to be very careful. Even when you're advised to take a walk, you'll be told things like, okay, 10 minutes walk, 5 minutes walk, 7 minutes walk. Don't start carrying heavy load. You want to start lifting. You want to start doing crunches. You want to start doing the heavy thing. No, don't strain yourself. You want to be standing for a very long time. It's going to put tension on that wound. You want to start you want to go and tie your tummy and tie it, figure 8 it, so that the tummy can bounce back in 2 weeks. It's going to affect that wound. It's going to put pressure on that wound and can cause that wound to open. Okay? Now, if you have any underlying medical condition, you have a health challenge before the surgery or during this recovery period, it may affect your wound healing. It may delay your wound healing. Things like you have diabetes, you have problems of high blood pressure, preeclampsia, it may affect your wound healing. Or you have HIV infection, this will affect your wound healing because it's going to suppress your immunity. It's going to drop your immune system. And once your immune system drops, the wound healing will be delayed, especially if there was prolonged labor or obstructed labor. This can put so much load, work on the body that the time of repair, time of healing may be prolonged. All right? So please take care of yourself. Take care of your wound. Eat well. Dress it in a good place. Okay? Don't rush your healing. When you do all of this, your wound will smile at you. Your wound will heal well. And if you are already having this issue of wound delay, go through this list I have mentioned. Check which of them may be responsible and start correcting them. And please always make sure that your wound is being dressed by somebody who knows what is doing. Because I know that you will not carry your Owambe list to Obioma or carpenter to make it for you. You will always look for that good designer to design your dress. So how much more your body? All right, please save this video. You may need it again. You may need to watch it again. And remember to share it with your friends. Share with other mothers so that they too can be on the same plane with every one of us. And if you are yet to follow me, what are you still waiting for? Do the right thing now. All right, guys, I'll see you in the next video. Bye-bye.